to my channel. Thank you guys for clicking on this video. If you are interested to know what you need to know before taking your pharmacy tech exam, I need you to continue to watch this video. Please like, comment, and subscribe. Let's get to the video. All right, y'all. So a little bit about moi. My name is Hillary Johnson, and I am a certified pharmacy technician. I have been a certified pharmacy technician for 9 years, and I like my job. I am currently in a hospital setting. So yeah, it's a little bit about myself. I did go to school to become certified. Okay, so just to give y'all some tips, what you need to know before taking your pharmacy technician exam is if you work already currently at a pharmacy, you work at CVS, Rite Aid, Walmart, wherever you work, and you are wanting to take your exam and pass it, I would use my job experience, okay? So if you already work in a pharmacy and you're not certified, I would use my job experience. So I would talk to my colleagues, ask them questions, ask them if they have pharmacy technician books, because most of the time, your colleagues that you work with are going to be certified. So you want to ask them for advice, like, hey, how did you study? Do you have any books that I can borrow? If they let you borrow their books, then that's a great thing. Learn on the job. If you see, if you working as the cashier in a pharmacy and you are dispensing a patient their medication, you can look at the bottle and just read what medicine that you're dispensing to them. And if it's pantoprazole, that's the generic name for Protonix, but on the bottle, generic pantoprazole, you can say to yourself, when you look at the bottle and it says pantoprazole, remember that medication, go home on your lunch break or whatever, and say, let me look up the brand name for pantoprazole. Because as a pharmacy tech, you're gonna have to know brand and generic. And research, okay? Look in your phone, it's Protonix. Okay, and just do that constantly on a daily basis. Just always absorb information in your brain. Use your job experience. You working there, so you already in a pharmacy setting, so use your job experience. Talk to your colleagues, talk to the pharmacists. They should have some type of resources, books or anything that you're able to borrow. Also, I would go on a few websites. I have a few resources for you guys to go on to look up these kind of things. So the resources that I would let you guys know about will be Quizlet, Quizlet.com. I used Quizlet so much before I became a pharmacy technician. I also will go to pharmacytechstudy.com, and I'm going to put these resources in the description box down below. But yeah, go to pharmacytechstudy.com, and on there, if you need help with math, if you need help with pharmacy law, if you need help with HIPAA, you need help with drug interactions, top 100 drugs, you need to go there and just type in whatever you need. Those are some good resources. Also, you can go to Google and type PTCB, Pharmacy Technician Training, and you can pull up all the information that you need. You can pull up practice tests. You're able to pull up, you can take as many free practice tests that you want. And these are all free resources, okay? You don't have to pay anything for this information. But yeah, I would take as many practice tests as I can. I remember, even though I went to school, I remember still I would be home and I would just go to a PTCB training, and I would just take as many practice tests as I could. I was just taking practice tests nearly every day to get myself ready for the actual national exam. If you are excelling and doing a great job in a certain area, let's just say you're good at math. So let's say on the math practice exam, the questions on the practice exam, you have math questions. You're getting all those right. You understand all those. Okay, so that means that you don't have to focus on that. Don't focus on math because you're good at math. If you are missing like the pharmacy law questions. That means that you need to circle whatever you got wrong on that practice test. You need to take you a pen or something like that. You need to circle that circle that number to let yourself know the ones that I circle is the ones I got wrong. So those need to be the questions that you pay attention to. Those need to be the questions that you spend your time with researching, your time with, like I said, going to these research sources. That needs to be what you spend your time on, because it helps in that area. You already got the other stuff down pat. So I will focus on that. I will focus on your weaknesses. What are your weaknesses? What are the questions that you are getting incorrect? Okay, because you need to know a clear understanding of why you missed the question. You know, if you miss a question, you need to ask yourself, why did I miss that? Why did I miss that question? Okay, so that obviously means I need to go back and I need to focus on that. Okay, now the PTCB test has 90 questions on there. From what I remember, I think I don't know if it was a minute per question. I got like less than 2 hours to take the test, and it was 90 questions on there. So you don't want to spend too much time. Like on these practice tests, you want to act like you are taking the test. You don't want to spend too much time on one question, okay? Because if you spend too much time on one question, you're going to run out of time. To the dollar store, get you some flashcards. I have to show y'all how I studied for my test too. If you want a video of how I studied for my test, just let me know down below in the comment section. But use flashcards, like especially with the brand and generic medications. I would write brand on one side of the card and the generic name on the other side of the card, and write what the category of medicine it is. And so when you flip it, you can see, you know, either side. So that's how I used to study for my top 200 drugs, because you have to know those, and it's 200 of them. So you want to be study smarter, not harder. You want to make it easier for yourself. Also, everybody study differently, but I would suggest to go ahead and schedule your test maybe 3 months out from, you know, so you can have time to study. So you can have 3 months to study basically, because life things happen. If you work a full-time job, it's going to be harder to study because you're already working a full-time job, but you have to prioritize and say, this is important. You know, it's only temporary. You're only going to have to study for a temporary time period. So I would prioritize. If you have any distractions, you need to, it can be family, it can be friends. You need to let those people know, hey y'all, I'm gonna have to spend an hour, 2 hours studying. You're gonna have to shut your door. You might have to close your door and let them know, look boo, look honey, I gotta study for this exam. I gotta pass this exam, okay? So I can be making that certified money. But yeah, you're gonna have to shut the door. You're gonna have to spend some time getting in those books. But don't stress about it and don't cram all this information in. So that's why I'm telling y'all to take maybe 2 or 3 months to study, because you don't want to cram all this information in a short period of time, okay? So be easy on yourself, be kind to yourself. Like I said, go ahead and just start studying. If you get off of work, spend time to yourself. You know, you got kids, do what you need to do, take care of them, get you something to eat, relax, drink you some wine, or drink you some tea or something like that, calm down, and then just get to studying. Like I said, study an hour. If you want to study an hour a day, 2 hours a day, it don't have to be 4 hours at a time. But if you study for an hour, I would say give yourself a 5-minute break in between. If you study for 2 hours, give yourself 2 5-minute breaks. But don't study and just study all these hours at one time, because then you are going to be exhausted. Okay, back to if you work at a retail pharmacy already, you can ask the pharmacy manager if they offer a pharmacy technician training. because if they offer pharmacy technician training, you can use that resource to study for the PTCB website too that I forgot. How did I forget about them? And I use them all the time. Amazon. Use Amazon. And especially if you got Amazon Prime, you get on Amazon, you can type in whatever book you need. If you need a math book for pharmacy technician, type in math book. If you need a pharmacology book for pharmacy technician, type in that. Amazon has everything. So go to Amazon and type in pharmacy technician books. Now it might be different editions and things in that sort, like years and type stuff, but anything will help you. Like the only thing that would change in these books would be like, laws change, pharmacy laws change, things as, new medications start coming around, things like that will change. But still, the fundamental of pharmacy is basically the same information, but they may add stuff, might take out some stuff here and there. But go to Amazon and order you some pharmacy technician books, okay? And this is the books that I got from school: Sterile Compounding and Aseptic Technique. It teaches you about the techniques of the IV room. And speaking of sterile compounding that's why it's so important, y'all, to have job experience too, if you can, because if you are already working and you're in a pharmacy environment, you're gonna see stuff every single day. You're gonna see stuff every day, things gonna happen every day. It's like you're constantly learning if you choose to. So like a hospital setting, you only do sterile compounding at like a hospital setting. So Facebook, if you have a Facebook, we have a pharmacy technician group. Basically a group of pharmacy technicians to where we all communicate with each other. If something is going on, it's mostly like, retail pharmacy technicians where we go up there and we discuss. They ask questions. Hey, have y'all heard about this new drug on the market? Hey, do y'all do this at y'all store? Hey, do y'all have this medicine at y'all store? Hey, have you started seeing where it's a different criteria for immunizations and flu shots and all that type of stuff? So we go in there and communicate all the time. And I'm pretty sure it's new or upcoming pharmacy technicians that could add their stuff to that group. And you have all these resources where you have all these pharmacy technicians that are discussing things. You can be added to that group and you can learn and just be exposed to all these resources. Y'all, it's so much out here. It's YouTube. Y'all looking at me now learning on YouTube. You have so many resources to how you can prepare yourself before this pharmacy exam. And also, I would suggest that you be in a good mood. Like, do what you have to do the day before that test comes. Get you some good sleep. And it's easily said than done because a lot of people, our stress factors are differently. But get you some good sleep. Go for a walk. Meditate. Stretch. Do what you need to do to get yourself up mentally. Watch you a good movie. That's what the night before the test. Watch a good movie, because you have to get yourself there. Like you have to paint your environment to what you want your environment to be. So you want to be cool, calm, collected. You want to be in a good mood. You want to have you want to eat that morning, have breakfast. You want to be around positive, good energy, people with good energy, people with good vibes. Talk to your mother, talk to a loved one. Hey, I'm here to take this test. Wish me luck, say your prayers, and you got this, okay? But let's just say let's just say you don't pass the test. It's okay. You can take the test again, but you do have to at least wait between 30 to 60 days to schedule for your next test for you to take your second pharmacy tech exam. Please like, comment, and subscribe to my channel, and I will be posting new content, so be on the lookout, y'all. I thank you guys for watching, and always love you guys. Y'all have a great day. Thank you guys for watching.